uncertainty, probably like anyone, going into an encounter with a new person, even if it's someone that is not completely new that you've known before. Anytime you go into an interaction, there's some uncertainty about how the interaction is going to go. So going to the internet and then being able to look up the diagnosis, or maybe even self-diagnose before you go to a provider, that provides patients with some idea of what to ask. I think to treat each patient individually is really important. Not to rely on stereotypes, not to kind of think that all patients are the same. And we know that doctors are trained in the biomedical perspective, so every human body is the same. You should be able to treat every human body the same, and ailments or illnesses, no matter who it is, it should be the same, and that's how they're trained in medical school. But we know that the biopsychosocial perspective would say differently, because the human experience, the mental, emotional, psychological experience that goes along with illness changes that illness experience and does change the way the body reacts. So it's different for every person. And we want our doctors to have knowledge and be, prestigious in some ways, but that power difference creates some maybe nervousness in patients, where they feel unsure again of what to ask. They feel maybe embarrassed about taking up the provider's time, and sometimes they get flustered and they don't remember the questions.
Would you ever make a list of questions for your doctor before meeting with them?
I would never make a list of questions for my doctor before meeting with them.
Write that list of questions so that you remember it, but also to prioritize your list so you really get that important stuff talked about early in the interactions. I think it's acceptable. I think, kind of building those relationships and building that rapport with patients is probably a good thing, especially for younger generations, because younger generations are the ones that are using more of that technology. If you talk to older patients, maybe 65 and older or 70 and older, they might not be interested in that kind of communication with their provider.
How would you respond to getting a text or email from your doctor?
I would like it, because then it would be easy to communicate with them.
Patients are just wanting to be more involved in their healthcare and in making decisions, having more information. So they're going to the internet, which is positive and negative, but they're also, just genuinely more interested because they want that partnership with their provider. That's good for many reasons.
Right.
Because we know that the outcomes are better when a patient is more informed and more involved in their health and healthcare.
Have you ever looked your symptoms up on the internet?
Yes, I have looked my symptoms up on the internet.